What about functional approach to treating mast cells? So you prescribe medicine, you also do um, a functional approach to it, which is one of the things too that I really appreciate with the way you practice medicine, is that you're not an all or nothing person. It's not like you can only take this, you can only take this. It seems like the combination of both world seem to be what works best. But what is um what would be your approach into combining both? And when it comes to mast cell, when somebody has mast cell, is there a way to eventually get rid of it so that you're not on mast cell medicines your whole life?
So yeah, it's a lot packed into that question. So I definitely take a holistic approach. I'm not really sure what functional means to be. I'm a traditionally trained guy, with the Duke.
Oh yeah.
And I take a holistic approach, which is a whole body approach. So diet, stress, like that's because I do think you have to layer in all of these factors to get people healthy. Like the gut is more than just, what you can see on an endoscopy. It responds to everything. Like this, we know that in people who have like chronic GI conditions or GI symptoms, that their symptoms are worse after a night of poor sleep. So you have to talk about that. You have to talk about hormones. Hormones have a humongous role in how our GI system moves. So I do like to take everything into consideration. Um, you mentioned, is someone going to need to be on medications? I think so. I think so. But everybody's different. Like, so if you can cut out high histamine foods, we also find that a gluten-free diet can also be really helpful. That may make your symptoms at bay sufficiently to not need anything else. But I do think as long as we're in this environment, it's tough, right? Like I have a patient whose mast cell gets pissed off by the electromagnetic frequency on the phone. What is he going to do, right? You can't escape this world that we live in, right? The paint on the walls, the pesticide, like you just you it's tough. I think this is a product of our times. And so it's immune dysregulation, right? Let's call what it is. It's immune dysregulation. And sometimes you need medications for it, but I don't force it on anybody. Like it's called shared decision making, where I say, I don't know everything about this. I think I know a lot about it, but I think the book is yet to be written on it. And this is what I know about it. And this is how I see people get better. Now, taking this into consideration, how do you want to get better? And where can we meet in the middle? Because when someone becomes like a non-compliant patient, which means the patient doesn't follow the plan, that means the doctor made a dog shit plan, right?
Yeah.
Because they didn't listen to them, right? Because they try to enforce what they wanted or what they thought was best for the person without taking into consideration. Sorry, I cursed. I don't know if that's appropriate or not, but
Oh yeah, you're good.
it's been a long day.
Yeah.
Um, so it means that they didn't and I've done it too. Like I've had patients who are like, "Yeah, I know we made this plan. I didn't do it." I was like, "Well, that's my fault. I'm sorry. I didn't listen well enough." And
Mm.
sometimes we miss things. And that's why. And so the answer is, does someone need medications? No, like it's not cancer, right? It's not going to kill you. Where it's like,
Yeah.
okay, chemotherapy is going to be a really big game changer here, but could it lead to increased quality of life? Yeah. And so I will always tell people like this is kind of what I would think about like your symptoms and what I would try. Does that resonate with you? Is that in line with your moral and personal compass? And if it is, great. If it isn't, let's try something else.
Yeah, it seems like the in today's age, the narrative around medication is that it's just a band-aid to remove symptoms. Um, and people who I think have been dealing with autoimmune stuff or issues for a while, they go through the phase of just putting like a band-aid on, but then eventually they just want to kind of like cure the cause, right? So for example, um, I know for a fact I can start taking cortisone and I'll be doing fantastic tomorrow for sure. But I also know that cortisone in the long run has issues, like has severe side effects. And so I think people are worried about the long-term side effects or the long-term consequences of taking a medicine for a while. So what is the traditional kind of medicine for mast cell activation syndrome? And is there a world where people take it for maybe 5 years and then get off of it because it just kind of self-regulated itself? Or is it, do you see in your practice typically that once you start taking them, you kind of need to take them all the time? Or is it just there's no straight answer?
It goes back to the philosophy of mast cells. They're reacting to something. It's you're just calming down their reactivity with medications. So if you can get at what they're reacting to, then you don't need medications. I do feel that they're reacting to the environment. And that's why people move. Like
Yeah.
I had two patients move to France in the last 3 months because I feel so much better there. Right.
Wow.
And so they don't need medications in France, but when they come here, they need medications to get by. So again, it's a balance. And a medication is just the tool. Like that's all it is. And as long as you know what the tool is for, right? And you know the side effects, then it's up to you whether you want to take it or not.
What
We won't always know the root cause of things. We just won't. There's conditions like ulcerative colitis, Crohn's. We don't know the root cause of it. It has something to do with the environment, right? These weren't around 150 years ago, but something has changed in our diet, our stress levels, technology. Like there's so much that has changed that are inciting these autoimmune things. Like, is it because our microbiome stinks? Because our diet isn't great? Is it because we're always stressed? Is it because we don't move enough? Like there's so many variables here. But there's not a test that really show that. But if we go back to mast cell, I do find that, if you are on a medication and it makes you feel better, people say like, will I be dependent on it? I'm like, what does that mean? Does that mean that when you come off it, you feel worse? Is that dependency, or is that just the medication helps you feel better? Um, and when we talk about medications for mast cell, I mean, I've used so many therapies in the last month, everything from medications that have been shown that are typically used to prevent liver organ transplant rejection, because someone has a huge autoimmune component. So we have people with like really bad autoimmune mast cell, which means they have all their autoantibodies are positive and they have joint pains and fatigue, and we can't figure out what's going on. And then we use immunomodulators. Like that makes sense for them.
So this is like methotrexate.
Plaquenil, methotrexate, Prograf. Like there's people that have horrendous autoimmunity,
Yeah.
and they can't swallow, and they have all these positive autoantibodies, and it's just really, really tough. We use IVIG. Look, those are extenuating circumstances. But we use medications to, again, to kind of go back to the paradigm, is we can try to control the environment to the best, like that's the way to get you off medications. So I always give people as many levers to pull as possible, whether it's diet or kind of instructions about the environment, to not be on medications. But yeah, so the medications, we can use those to help block the mediators that mast cells release, like histamine blockers. There's also leukotriene blockers. Those are typically singular. That's used for asthma. Um, and then we use mast cell stabilizers. So you were referencing quercetin, which is a polyphenol. So there's a group of polyphenols that work really well as mast cell stabilizers. Rutin, quercetin, luteolin, high dose vitamin C. I usually do about 500 to 1,000 milligrams extended release. If you have kidney stones, you can't do that. But everybody's journey is different. And so I usually start in the same place with people with like histamine blockers, maybe some polyphenols. And then based on your response or lack thereof, we move in different directions. So I have some people that I put them on any medication and they react to it. Like they're that reactive. Any medication they take in my mouth, they feel terrible, right? So then you have to use like an injection, right? And like omalizumab or Xolair. So it gets kind of wild. And everybody's journey is different. And it's up to them how they want to feel better. And I just try to give them the roadmap.
All right. So there's not one straight medication.
No, no, no.
There's not.
So there's probably like 30 different therapies that I have in my armamentarium. But like L-theanine is a really nice one too. Like metformin is one that we use for diabetes. So if someone
Wow.
has polycystic ovarian syndrome and metabolic syndrome and prediabetes, like metformin is a nice option. Low dose Ozempic, like microdose Ozempic, can really help for some people. Not for everybody, but for some people. So it all depends on kind of what their symptoms are, what their comorbidities are, and what their preferences are. And I do my best to meet everybody halfway, to get a sense of how they want to be healthy and let them drive the ship. And I'm just in the passenger seat or the back seat, just being like, hey, like maybe make you want to like just this is kind of this is the roadmap, and you're driving the car, and let me know how I can help you.